Hello there, everyone. My name is Michael Riveras, and I'm the co-lead for the early childhood portion of the National Training and Technical Assistance Center here at Georgetown. And today is our last presentation of this particular series, but I would like to encourage you to please join us on some of the other things that we're doing that are online, or some of the materials that you can find online. And so today, we're going to talk again about provider education and well-being. My colleagues, Dr. Shai Porter and Dr. Pamela Trivedi are here, as well as Joanne Bloom, who is the technical assistance wizard without whom we couldn't do this work. And so, as in past presentations, we'll go through the beginning of our slides, and then we'll have a moment of reflective work and get into it. Materials in this presentation are drawn from a curricula that is in partnership with colleagues from Georgetown, the University of Maryland, and other TA Center partners, a collaborative. And I think that is one of our strengths, is being able to work with people from different ponds and pull this work together. This presentation was prepared under the INTACT cooperative that I just described. SAMHSA, the Substance Abuse and Mental Health Services Administration, also is a funder of this, but it's important to understand that although this work is supported with SAMHSA, by SAMHSA, there are two things. One is that we want to make sure that credit is given to the people who created it. So if you use it, please credit them appropriately. And then secondly, it's not necessarily SAMHSA's views that are shared in this. And so one of the things that I'd like for you to understand is the overview of who we are. As I mentioned, we're a collaborative. And so in that collaborative, that also means that we're multidisciplinary. I myself am a clinical social worker. Pamela and Shai are psychologists. And Joanne is a techno wizard without whom we could not get this work out. So we all come from different places. She also is communication, so able to say things probably a lot more clearly and succinctly than I am. But the Center for Applied Research and Solutions, CARS, is one of our partners. They're an umbrella organization here at Georgetown, the Center for Child and Human Development. And you can see some of the others: Texas, the University of Texas at Austin, the Family Run Executive Director Leadership Association. I really like pointing out FREDLA, because one of the things that is a cornerstone of what we do is making sure that families have a voice and consumers have a voice. And so it's through organizations like FREDLA where we're able to really not only leverage the voice of others, but also help others develop into leading voices for families and children. And so Net Youth Move is an example of that. We have young people coming up who have received services, and by participating in groups like Youth Move, they're able to learn how to present at the national and local level. Next slide, please. Our goal is simply that all children, youth, and young adults and their families with emotional or behavioral health needs can access evidence-based treatment and recovery service in a well-coordinated system of care. I can't overemphasize that. So it pulls together all of those things that I've talked about just now, the idea that families need voices, children and consumers need voices. Examples of our cross-sector audiences include state and local agency leaders, mental health workforce. We have our families, our primary caregivers, people who work in schools, like many are who are here today, community-based providers. These are all really important partners without whom we could not do this work in an equitable way. When we talk about the products or the things that we do, we have practical tools for clinicians or for educators to use. We have a podcast. We have a digest called 5 Things. These community practice seminars like this one today are examples of the things that we do to get the word out and to get information out about that evidence-based best practices, social emotional support that is available through not just what's happening at Georgetown and our partners, but when other organizations, universities, or people are doing things, we like to share that and incorporate that. And so there we are, Dr. Porter, myself, Dr. Trivedi. Today, we're talking about disconnecting with school, work or school, and engaging in restorative practices for the summer. I look at this image that is before us, and this is one of my dreams. I've always wanted to see the sequoias and the redwoods. I don't know why, but it's just something on my bucket list. But when I think about it, I also think about the trip or the journey that it will take to get there. And I look at this image and I wonder, what was this person's journey like to get there? How did, they had to have a plan. They had to be intentional. It's not like she could step out of her living room and be there. There was a lot of thought put into getting there. And when we think about engaging in restorative practices, one of the things that I'm convinced is that we have to be intentional in that. And it is a process and it is a journey. And one of the lessons of the past 2 years that we've learned with the pandemic is that for so many of us, the ability to have those transitional moments has been either diluted or completely taken away. I work from my home office. And so for me, the transition from Michael, the husband and father, is very short as I walk into this office and begin my work during the day. And sometimes the work that I do, even from afar, is very intensive work, like consulting people following shootings like the one here in Texas, the one that happened in Buffalo. As a mental health practitioner, I hold a lot. And when I was able to go to an office, I would often think about how my mom, who was a nurse and worked in infectious diseases, would come home with her scrubs, and she would be able to get out of those scrubs and then get into her regular clothes before leaving and have that transition. And so as we think about what we're talking about today, there's a huge part of thinking about it in the context of a transition. What are the things that I'm going to do as an educator, as a parent, as a professional who's responsible for others' children, to transition into this moment where I may have a couple of weeks or months, or some of us may work, but even if we are working throughout the summertime, how are we going to a degree, do a ritual of sorts, something that will allow us to transition into a summer, more peaceful mode, if you will. And what that does is it allows the brain and the body to reset. And so we've talked in a number of different ways about the physiology of the brain over the course of this series. We've talked about examples, and we've used tools to help us engage in that. And with that, I would like to hand it over to Shai, and she will lead us through the process of talking about, of doing that.
So if you were with us for our first session, you completed the Poise Assessment. Hopefully that sounds familiar. But the cool thing about this group is that it's rolling, so that there are people who joined us in session 2, and session 3, and maybe even some people who are new today. So in line with what Mike was sharing about being intentional about moving forward, making sure that we're aware of our well-being, I wanted us to try to take a minute, 5 minutes actually, to complete the Poise Assessment again. And what this assessment does is have you identify where you think you stand across several different domains, 5 domains to be exact, which we'll talk about in a second. What you see on the screen is what the assessment looked like. What we're going to do is break it down into its component parts. So what you'll see is that there are 5 different sections that relate to each of the letters in Poise. So the first 5 questions relate to your physical well-being. So this is relates to making sure that you're getting enough rest, making sure that you're getting enough sleep, making sure that you're eating well, exercising, integrating art and music into your life, etc. Are you doing well in the physical domain? Is what those questions get at. The next set of 5 refer to occupational well-being. So how much joy and pleasure are you getting from your work? Do you have a healthy work environment or not so healthy or toxic work environment? How well do you think you address obstacles in your workplace? Do you have the autonomy to configure your job the way that you want it to be configured, the autonomy to manage your time, etc.? So that's the second set of 5, 6 to 10. The third set of 5, 11 to 15, refer to your social well-being. So how that has those questions make you think about how socially connected do you feel? How much pleasure do you get from being around other people? How much time are you making for that? Are you asking open-ended questions when you're talking to people, or are you just kind of word vomiting at them and not really taking on the listener hat for yourself? Are you giving affirmations? Are you reflecting? Are you really being intentional about engaging with others in conversation? 16 to 20 refers to your emotional well-being. 11 to 15 refers to your intellectual well-being, which refers to finding meaning in your daily life and exploring your spirituality and making sure that you feel intellectually plugged in. The 5th set of questions, 16 to 20, refer to your social well-being. So what I said about making sure that you're getting connected with others. And then finally, 21 to 25 refers to your emotional well-being. And that's making sure that you're getting pleasant emotions from various things that you're doing in your life, making sure that you're feeding your soul, if you will, in a way that makes you feel grounded and happy, like you're able to manage stress in a meaningful way. And of course, there are other areas of well-being, but the Poise focuses on 5 critical ones: physical, occupational, intellectual, social, and emotional. There's financial well-being, spiritual well-being, et cetera, that are all equally valid. But this gives us a snapshot of how you're doing, at least in those 5 domains. So if we were to review those, next slide, please, Joanne. We have physical, again, referring to exercise, sleep, music, healthy eating, et cetera. Occupational, creating positive life experiences and roles and making sure that your career feels satisfying. Intellectual, making sure that you're challenging yourself, trying to avoid cognitive decline as much as we can. If you were in the last session, I talked about the brain and how if you don't use it, you lose it. So those neurons and those connections that they make when you are intellectually stimulating yourself, those are critical, and we want to make sure that we build those up as much as possible so that as we age, we continue to feel like we are cognitively sharp. Social, making sure that you're fostering your social relationships and encounters. And then, of course, the emotional realm, making sure that you feel grounded, happy, you're engaging in experiences that bring you joy. So I'm hopeful that this will give you a good sense of how you're doing across those various areas. In an ideal world, everyone would be 10 out of 10 in each one, or I guess 5 out of 5. But that's not realistic, right? And so really thinking about where those areas are that are lacking, and at this point in the school year or just in work, things, a lot of people feel very burnt out and over it and ready to move on to the next thing. Whether that's, like the next project or the summer or vacation, et cetera. And so this snapshot hopefully will give you a good sense of how you can create goals and some structure around moving into this next phase of the year, whether that's a break from school or the next phase of work, the end of the fiscal year, if you're in an organization like mine. Fiscal year ends June 30th. We're using this as a baseline for our next activity, which is to create SMART goals.
So when I first started off in working in substance abuse and violence prevention, we use what is called the Lokahi wheel, which I popped into the chat box. And in case you can't open it, this is what the Lokahi wheel looks like. And it's basically a piece of pizza with the different slices. And what we would do with our participants is my colleagues came up with this device where you put an egg in the center and there's strings connected to it. And then based on how you're feeling, you kind of like go more center if one part of your now your center is, off-centered. And then they would be able to see how that egg would tilt and not be pono, not be in lokahi, not be in balance. So what do you do to adjust the rest of your life to keep that egg in balance and things like that? So it was a really good visual and physical way for them to see how, if I'm having a hard time in work, how do I make that string, my hand go farther back on the string? Or if I don't, in order to keep that egg balanced, you go closer in. And even though it's balanced, we would talk about, are you really healthy if you have to give in or you start having struggles in the other areas? So it was a really good concrete way for, in a culturally respective way, to teach about the 5 parts of your well-being.
Yeah, that is awesome. C, thank you so much for sharing that. It's excellent. And you're exactly right. It is very similar to this Poise assessment. So hopefully everyone can open up the document or the photo that C pasted into the chat. I had to click on it a few times for it to actually download. But I'm thrilled to have that in my files now. Thank you, C. And thank you, Pamela, for pointing that out. Awesome. You're muted. I'm not sure if you said something, Pamela, but okay. All right. Okay, so thank you, Joanne. The next activity that we're going to do is also a callback to either our first or our second session, which was creating SMART goals. So as a reminder, SMART is also another acronym, stands for salient, measurable, active, reachable, and timed. So when we think about SMART goals, we want to make sure that we're creating goals that feel targeted and specific and actionable. And this acronym will help us achieve that. So as a quick review, salient refers to choosing meaningful goals that are easy to understand, they're relevant to you, they're not just something that other people have imposed upon you or that you feel like you should create just because you have to. Because as an adult, you're supposed to create certain types of goals, right? SMART goals are measurable. They define exactly what needs to be accomplished. There's a clear sense of what it looks like when it's not happening and also what it looks like when it is happening, whatever the goal is. SMART goals are active rather than passive. It's very specific and clear about what actions are needed. They're reachable, so they're realistic. It's not like I'm going to do 2 hours of exercise a day. For some people, totally doable. For lots of other people, that's not, right? So making sure that they're realistic, they're based on your experience, they're based on your skill set. And of course, they're timed. So we want to have a clear date for completion. When is this? At what point will I assess whether this goal has been achieved and whether it's working? So this should have been a review for most of you. But even if you weren't here for the session that we discussed it, in which we discussed it, SMART goals are ubiquitous in lots of these types of trainings. And so I'm sure you've heard about them before. So what I would like you all to do at this point is, based on your poise, based on areas that you acknowledge are maybe not as strong as you would like, try to create at least one SMART goal. I just want to say I so appreciate all of you who came today and who have come to the other sessions, getting your feedback and being able to engage with you all from all around the country has been amazing. This is my first community of practice and it's been a lot of fun. So thank you all for your participation and for showing up.
And I echo those sentiments. Thank you, everyone, and look forward to building a curriculum for next year that will be enjoyable and informative.
Take care, folks. I think we can close it out on that note. We're really grateful for you all.